I'm Dr. Fazalunnisa, gynecologist and infertility specialist, Hira Fertility Center, Tolichoki, clinical head. Today we are going to discuss about what are the causes of infertility that are happening that we are seeing very frequently these days. So before that, we need to know how a natural pregnancy happens. So every month in a normally menstruating woman, there is something called as ovulation. So the eggs might get released from either right side or the left side of the ovary. At the same time, when the husband and wife are meeting at the same particular time, the good sperms which are there, the mobile good sperms are going into the egg and fertilizing and making a baby happen. That is called as an embryo. Embryo is first formed in the tube, then later gets on into the uterus. After 5 days, if everything is good there, it's going to get implanted there, grow there for 9 months and come out as a beautiful baby. So it's like a seed and a soil technique. So the embryo is the seed, so you need a good seed, and the uterus, endometrium, is like a soil. So whenever there is a proper seed and soil method, that is the time when a pregnancy is gonna happen naturally. So you need a good seed, also a good soil for a good tree to come up. So in the same way, you need a good embryo and a good endometrium for a natural pregnancy to happen. So now we're going to see what are the causes or the hindrances that are happening during a natural pregnancy. So firstly, when the sperm is going inside the uterus, there is something called a cervix. Cervix is the mouth of the uterus, that's the entry point of the uterus. So whenever there is an infection or whenever there is a os problem, there is something called a cervical os, which is a small hole in the cervix, which allows the sperms to go in a linear fashion. So whenever there is a problem with the cervix or the cervical mucus, there is some liquid coming out from this. So if there is a problem in this area, the sperms are not going to enter into the uterus properly. So that is the first thing where there can be a hindrance. Next, when coming up into the tubes, if there is an infection in the tubes, say something called as hydrosalpinx. Hydrosalpinx is something where there is water and infection accumulated in the tubes that will not allow the sperms to go inside the tube. So the other hindrance which comes here is the tubal blockage or the hydrosalpinx. So the main process of fertilization which is supposed to happen in the tube does not happen here. Third is somewhere where there is, in the uterus, there is some infection or there is a polyp or there is a fibroid or any kind of hindrance which is not allowing the embryo to come and get implanted into the endometrium. So these are some of the causes. Apart from these, there are some multiple infections from the level of vagina to the level of tubes. So these are called as pelvic inflammatory diseases, which do not allow a natural pregnancy to happen. These are the places where if there is a vaginal infection or there is a chronic endometritis in the uterus or there is a tubal infection, these needs to be cured first, because with infections around, the egg and sperm are not going to get fertilized. Even if they're going to get fertilized, it's not going to get implanted into the uterus, into the endometrium. Also, there is something called as Ashuman Syndrome, in which it's a final stage of tuberculosis in which the whole of the tuberculous bacteria is eating away the wall of your uterus. So the wall of the uterus where the baby is supposed to grow, this is all eaten up by the tuberculosis bacteria, and there is no place for the baby to grow because there is no endometrium. This is called as Ashuman Syndrome, where the walls do not have space and the infection is eaten up, the endometrium is eaten up by the tuberculosis infection, and this is a very critical case which needs to be definitely sorted out. Also, we see ladies who have tried multiple times, a lot of investigations are done, everything is okay with the husband and wife, still they do not get pregnant. This is called as unexplained infertility, wherein the sperm is not able to go inside the egg because the egg is 10 times bigger than the sperm, and sometimes it does not allow the sperms as it has some antibodies against the sperms, so it recognizes the sperm as a foreign body, so it does not allow the sperm into the egg. So in such cases, all these cases have to be ruled out, and we have to see why a pregnancy is not happening. Also, the single most important factor is the male infertility. Not only the quantity, but the quality of the sperms is also very important. So we have to see how the motility is. The motility is the fastness of the sperm. The motility is supposed to be at least 40% progressive sperms. Also, the morphology, the shape, size of the sperm is also very important. So this shape and size which is there, it needs to go and penetrate into the egg, and the morphology is supposed to be at least 5%. Like say suppose the 95% of the sperms do not have a good morphology, at least the 5% of the sperms which are there, they should have a good shape and size, so that they're going and getting into the egg. So with considering all these factors together, like the tubal factors, the endometrial factors, the infections, and the male factors, and the unexplained infertility, and sometimes of course the hormonal imbalances, like 80% of the time, the majority of the time we see the women are suffering either with PCOD or thyroid issues or the other hormonal issues. So all this putting up together, we need to come to a conclusion why the couple is not able to get pregnant, and give a personalized care plan to this couple. Please like, share and subscribe Hira Fertility Center, and please pass on the information to many other people. Thank you.